What if I told you that a silent disease is slowly stealing the breath of millions of people, often without warning and often without early pain? Chronic obstructive pulmonary disease, commonly known as COPD, is a serious and long-term lung condition that makes breathing harder over time. It does not appear suddenly. Instead, it develops quietly, damaging the lungs little by little, sometimes over decades. Many people live with COPD for years before they are officially diagnosed. COPD is not a single disease. It is a group of progressive lung conditions, mainly chronic bronchitis and emphysema. Chronic bronchitis causes long-term inflammation and excess mucus in the airways, while emphysema destroys the tiny air sacs in the lungs that are responsible for oxygen exchange. Together, these conditions block airflow and reduce the body's ability to get enough oxygen. There is no cure for COPD, but early diagnosis and proper treatment can slow its progression and improve daily life. According to data from the U.S. Centers for Disease Control and Prevention, nearly 4% of adults in the United States have been diagnosed with COPD. This percentage represents millions of people struggling with shortness of breath, chronic cough, fatigue, and reduced physical ability. COPD is one of the most common chronic lung diseases worldwide. Age is one of the strongest risk factors. The prevalence of COPD increases steadily as people grow older. Among adults aged 75 years and above, more than 10% have been diagnosed with COPD. In simple terms, 1 out of every 10 older adults is living with this condition. Aging lungs are more vulnerable to long-term damage caused by smoking, pollution, and repeated infections. Gender differences also appear in the data. Women are more likely to have COPD than men. CDC statistics show that just over 4% of women report having COPD, compared to about 3% of men. Researchers believe this difference may be linked to biological factors, differences in lung size, smoking patterns over time, and exposure to indoor and outdoor air pollution. Race and ethnicity reveal additional patterns. COPD prevalence is lowest among Asian adults, while higher rates are observed among other racial and ethnic groups. These differences may reflect variations in smoking behavior, occupational exposure to dust or chemicals, environmental conditions, and access to timely health care. Socioeconomic status plays a major role in COPD risk. Adults living below the poverty level are significantly more likely to have COPD than those with higher incomes. Limited access to healthcare, delayed diagnosis, poor housing conditions, and higher exposure to environmental pollutants all contribute to this increased risk. COPD is not just a medical issue, it is also a social and economic one. Overall health status is one of the strongest predictors of COPD. Adults who describe their health as fair or poor are more than 5 times as likely to have COPD compared to those who report excellent or very good health. COPD often occurs alongside other chronic conditions such as heart disease, diabetes, and arthritis, making daily life even more challenging. Why is COPD so dangerous? Because it affects far more than breathing. COPD reduces energy levels, limits physical activity, increases the risk of lung infections, and leads to frequent hospital visits. Over time, it can prevent people from working, exercising, or even performing basic daily tasks. COPD is also one of the leading causes of death, particularly among older adults. Smoking is the leading cause of COPD. Long-term tobacco smoke damages lung tissue and inflames the airways. However, smoking is not the only cause. Long-term exposure to air pollution, workplace dust, chemical fumes, and secondhand smoke can also increase the risk. In some cases, genetics play a role, making certain individuals more vulnerable to lung damage. One of the greatest dangers of COPD is late diagnosis. Many people ignore early symptoms like mild breathlessness or persistent coughing, assuming it is just aging or poor fitness. By the time COPD is diagnosed, significant and permanent lung damage may have already occurred. The good news is that COPD is often preventable. Quitting smoking, reducing exposure to polluted air, and seeking early medical evaluation can dramatically reduce risk. For those already diagnosed, proper treatment, medication, and lifestyle changes can slow disease progression and improve quality of life. COPD is not just an individual health problem, it is a major public health challenge that affects families, healthcare systems, and societies as a whole. Awareness, prevention, and early action are key. This is Scientific Research Videos, bringing real science, real data, and real awareness to the health issues that shape our world.